Integrative medicine isn't different than conventional medicine. It's just a focus on certain issues, if you would. So the first thing is diet, and we do maintenance diets and we do therapeutic diets. The second is nutritional supplements. So if we use them, we try to look for evidence basis on their value and actually follow things up to see if they're having the effect desired, unlike going to the vitamin shop. The third is herbal therapy, which is another form of medicine, and we have trained licensed herbalists that help our patients with that. The fourth is exercise, which Jonathan will address, and it's extraordinarily valuable in terms of health promotion. The fifth is physical therapy, which Jonathan's specialty is. The sixth are energetic therapies, so like acupuncture or the lymphatic enhancement therapy we offer people. And the seventh are self-regulation therapies, the EEG biofeedback training, the mindfulness meditation. And we try to incorporate that into our conventional primary care practices, many of you know. Jonathan's going to address the issue of exercise and bone health, but in my opinion, it's almost as important to talk about exercise and musculoskeletal health, because in the aging process, it's the loss of muscle mass that ultimately results in frailty, dependency, disability. And we think that we have very good strategies in helping to guide people in delaying the time of frailty and dependency. I think there's a almost inevitability, but every day I'm amazed at how many of I had an 85-year-old come in this Thursday, a new patient, blood pressure was high. So I said, well, what do you do? She says, well, I work. I said, wow. But she works, in some office. She says, I just work part-time. I go in at 9:30, I leave at 3-4 days a week. And I thought, I could do that. I could do that if I could still be standing when I'm 80. So at any rate, the key to it is musculoskeletal health. Jonathan's going to speak about it from the point of view of osteoporosis management, because we have, I think, a unique set of services to render in that regard. And without further ado, Jonathan.
Basically what it is, it's characterized by low bone mass, deterioration of the bone tissue, and it's one of the leading causes of frailty and susceptibility of fractures as we age, most commonly occurring in the hip, spine, and wrist. So we probably all know someone, grandma so-and-so, fell and broke her hip, and down the road she went. So normal bone, very dense here, very tightly packed. Good structure, osteoporotic bone. We've got lots of voids, lots of space in between there. The bone is thinning out and becoming more porous. So why does it occur? The bones, your bones are constantly changing. You're constantly adding new bone and getting rid of old bone, so formation and resorption. When we're younger, we're creating or forming bone at a faster rate than we're losing it. Up until about around age 30 or so, where we've got our peak bone mass density, or our peak bone mass. After age 30, we see a kind of a slowly decline in bone formation, and that can pick up after menopause, and it persists as we age. So when the bone resorption, when we're taking away bone faster than we're adding bone, is when we see that uptick and spike in osteoporosis. If you did not reach your optimal bone mass in your younger years, we see the osteoporosis is more likely to occur then. You're starting with a weaker bone to begin with, so you're constantly losing, and you've got less to take from. So again, risk factors. I'm going to see over here. A little hard to see, but so again, the risk factors you can't change. Gender. Women are more susceptible than men. Age. As we age, our bone density goes down. Body size. Small, thinner boned women are at a greater risk for developing osteoporosis. Ethnicity. Caucasian and Asians are at higher risk. And family history. You can have a hereditary defect in your bony matrix or how you make bone that could have you more susceptible to developing a fracture. So we want to focus on, again, the things we can change. The doctors have talked about the sex hormones, anorexia, diet. Again, if you have low calcium, magnesium, and vitamin D intake, you're going to have weak bones, no question about it. Medications, prolonged use of steroids can weaken bone. Activity, decrease activity, you decrease the force on the bone, you decrease the strength of the bone. And habits, again, smoking, excessive use of alcohol, all those things can affect how you form new bone and what's going on with the enzymes and the processes to form new bone. So, not the best picture, but we've got a 50-year-old, a picture of a woman at 50 and at 75. So what happened? You know, she developed this little bend here, most likely due to an osteoporotic fracture, a compression fracture of the vertebral column. So we put this picture in here because a lot of exercise that we prescribe or recommend for osteoporosis, it's cheap, it's easy. Walking, dancing, climbing stairs, those things. Those are excellent for the hip and the spine, the long bones of the leg. We have less effective as it goes up the spine. So we see a higher incidence of these thoracic curvatures and compression fractures. And again, the wrist fractures. We see a lot of wrist fractures or a lot of incidence of osteoporotic bone in the wrists because we're not loading those bones as much. We're not pushing or pulling aggressively through the arms. We're not compressing the spine from the top down. We're usually having compression from the bottom up through the legs. So we, when we developed our bone health program, we want to make sure that we hit everything. Okay. So what can you do, or what can we help you do for osteoporosis? And here it is: diet, exercise, diet, exercise, diet, exercise. So diet and activity are the two best things you can do to decrease your risk factors for developing osteoporosis, for your osteoporosis worsening, or for developing a fracture. And again, Dr. Ross alluded to, we take an integrated approach of how we're going to address that. In physical therapy, we have three kind of main areas that we look at in our practice. Cardiovascular conditioning. We said if you're not active, you're not loading the bones, your general physical level of activity is less, your musculoskeletal system is in disrepair and it's in dysfunction, and you're just going to suffer greater sequelae, or you're going to suffer more problems if you're less healthy physically. We look at resistance training and weight-bearing exercises, and in our practice we add whole body vibration therapy. So the role of exercise in osteoporosis prevention and management, we're going to make the bones stronger physically. We are going to stress the bones. Bones grow when they are stressed. They respond to the forces placed on them. Going through school, we learned Wolff's Law. The more you load the bone, the more the bone's going to grow. We want to do things to compress, bend, or even pull on the bones. So compressive forces, torsional forces, and tensile forces. So muscles and tendons pulling on bones, the weight of your body, or more, or any kind of weight compressing the bone. That creates a stimulation in the bone for the bone to start to grow. The osteoblasts, the bone cells, will pull in minerals around them, and they will grow and be stimulated to produce new cells. Again, weight-bearing exercises against gravity, walking, climbing stairs, dancing, excellent for the hips and the lower spine. Resistance exercises are also going to improve your muscle mass. Okay, so if we improve your muscle mass, we improve your strength, we improve how much we're pulling on the bones. So there's a direct correlation there. If the muscles are stronger, they pull harder on the bones are stronger. They have to be stronger to resist that activity, resist the tension of the muscles. So free weights, weight machines, this is what has been the standard in therapy and exercise, you know, lifting weights. What we have added to our therapy is a device called the biodensity device, and it doesn't use any drugs, and it's been shown to be very effective in helping produce stronger, healthier bones. It provides osteogenic loading stimulation. It loads the bones. Okay. There is also a neuromusculoskeletal stimulus that occurs, as we increase the load on the bones beyond the weight of the body. Okay, so if we are increasing the load that the body usually responds to, we're going to get better results faster. Dr. Ross will attest to this personally. So he comes down and takes his shirt off in the gym. What can I say? He's showing us his muscles. All right. So the loads that we can generate with the biodensity device are leaning towards what we would consider impact activities. So we don't want you to go out and jump and hop and skip and all these things, especially if you have osteoporosis. But we can apply that level of load through the biodensity machine in a safe manner. So again, we're increasing the load on the bones and the muscles in a safe manner. And that's going to lead to increases of muscle density and bone density and muscle strength. We are going to create a, let me skip over here. Oh yeah, here we go. So again, looking at the bone density. So the DEXA scans, looking at users of the biodensity device, have shown an average of between 5 and 6% bone mass gain for people that do the program regularly. And I'll be more in depth about the program in just 1 minute here. So we want this nice dense bone here. We don't want all these voids and empty spaces in here. We also generate myofibril muscle development. So when we do normal strength training, we can get some hypertrophy of the sarcomere, which is kind of the bigger unit of the muscle. Muscles are like ropes. They're made of a bunch of small fibers bound together, and they make up a big motor unit. So what we do, what the biodensity device can do, is with the amount of load we're putting on there, because it's a fairly intense amount of activity and load, we don't just get this hypertrophy of the muscle in general. We actually create more myofibrils. We get the smaller units become more prolific and are stronger in overall. So it's a very good mode to generate muscular strength as well as bone health. And my picture of the device got bumped out of here somewhere, but the device is downstairs. And if you have it's in the pamphlet, yeah. It's a station that uses force gauges. You do 4 lifts. You're seated and you do a chest press. So we load through the wrist, very important, through the arms into the upper spine. You do a leg press, so you're sitting and you're pushing with your legs, and you compress the hip, the spine, all the way up to the mid-back. You do a core pull, so we have you're kind of in a seated position, and to do a crunch down this way. So we compress the spine with the abdominals. We get loading through the long bones of the arms and the wrist, tension forces on the wrist. And then you do a vertical lift, which would simulate picking something up from the floor. So we get intense, short durations, about 5 seconds of intense loading of the muscles and the bones in a safe manner. And you get immediate feedback from the machine. It shows you your previous result. It shows you where you should be based on your age, gender, and height. And we can show you where you fall compared to population norms. So it's a very nice machine. It takes all of 5 minutes once a week to get a tremendous amount of loading through the bone and developments in muscular strength. As you do the device, we track your results, and we just see the force increase. The latest study came out. It was over 4,000 subjects. They all increased muscle strength, bone density, and force output. So they physically got stronger all around. So we combine that biodensity training with our whole body vibration. And what that is, it uses sonic vibrations to trigger a reflex response in your muscles to get full body activation. And we go through a series, if we want to target the muscles more, we have a range of frequencies where we can adjust to hit different muscle groups. It brings deep circulation into the blood, deep circulation into the muscles. It helps restore joint and it helps restore blood flow to the joints, and also lubricates the joints. Motion is lotion. When you move the joints, you lubricate the joints. So we want to keep them moving. And it can increase overall, again, it can help to increase bone mass and muscle strength and flexibility while you're kind of hanging on, you're standing in one spot doing a kind of, we call it a super isometric. You're doing a lot of repeated exercises in one place without having to move, adjust weights, things like that. Particularly for bone health, the studies that we've looked at, there's a range between 25 and 30 hertz of frequency where we see the best impact on bone loading. And you are standing on the device. This is the device here. You stand on here, you hold on, and it shakes. Okay, but it's a specific frequency what we shake at. Instead of giving you one exercise where you do 20 reps, you know, we're getting 25 to 27, almost 30 contractions per second. So we're getting you a whole lot, 1,500 to 2,000 contractions over the 10-minute cycle there. So. I'm sorry, in each minute you're getting 15 to 2,000, so you're getting upwards of 20,000 repetitions in a 10-minute session. I've used it, feels really good. We use it as a warm-up, we can use it as a cool-down, we can use it to stimulate the bone activity. And that's about it. So we add those things to a kind of normal or established strength training regimen to address bone density. And if you would like to see any of these things, we're downstairs at 1:30.
Values to it. And the whole body vibration's been good for people with peripheral neuropathy. So when they have the tingling in the feet, the reason is that the first time you use something like that, you feel your feet tingle, and the feet are tingling and warm because these tiny little blood vessels in your lower extremity get dilated, and there's a vasorum are the tiniest little arterioles that are feeding the small nerves, and they get dilated, and you're improving blood supply and oxygenation to the nerve tissue. So we've had benefit in there, and there's evidence that it helps with pelvic floor health in women and men, and among other things. So there's all sorts of interesting secondary values from that, and then we've given you information that I wrote about osteoporosis in general, dietary information about non-dairy sources of calcium, not that dairy is bad, but just so that you know you have a broader range for those who are lactose intolerant, etc. And nutritional supplements that have evidence basis for improving bone density. But in my mind, whether you're taking a conventional medication or you're doing the supplements, it's, you know, like spitting in the ocean if you don't exercise. So I hope any one of you who wants to takes advantage of that. I don't know if you have the time this afternoon to show anyone who wants to see it.
Antoine will be down there.
Oh, Antoine will be down to show off the equipment. Any other questions? We talked you out today. Thank you for coming.
Thank you.